My name is Orla McDonnell. I'm a GP in Cork and I'm a recent graduate of the Southwest GP scheme where I spent 4 happy years there. So the practice here in Kinsale, it consists of 7 doctors. That includes myself, a fellow, and also a GP trainee. Outside of that, we have a nursing team, including nurse prescribers and practice nurses. We also have the value of a practice manager and an admin team. On completion of my GP training, I was very much interested in the academic side of general practice, and I decided to apply for the fellowship, which is offered by the ICGP, and I was gladly took up that role. That commenced in July, and as I say, working half-time in clinical capacity, 2.5 days a week here in Kinsale, and I also work 2.5 days in University College Cork in a research role. And it's been really interesting so far, and it's been a chance to, I suppose, further my studies, and has the added advantage of the fact that I have an academic supervisor. I hope to continue with this academic work. I also really enjoy teaching, and we do have medical students here in the practice with us, so I really enjoy doing the academic work myself, but also teaching students. So I hope to continue down that line in the future. I think it is a good time to become a GP because the specialty in itself is changing. We have moved to electronic prescribing. We've also moved to, I suppose, telemedicine. Often we might do a phone consult with our patients. Outside of that, our colleagues are changing roles. Nurses are becoming nurse prescribers, which is certainly alleviating pressure on GPs. Outside of that, the chronic disease management strategies have come to the fore, where we're managing patients before any sort of acute crisis unfolds. So I think the beauty of general practice is that it's becoming more about preventative medicine as well as health promotion. And I think it's an exciting time to become a general practitioner. What I would say to someone thinking about a GP is that the work in itself is challenging, but it's hugely rewarding. It's a very busy specialty to be in, but it allows for huge diversity within the job. Firstly, you have an opportunity to develop specialist interests. In my case, it was academic general practice, and that all tied in together when I started this fellowship. If you have other interests, there's opportunities to pursue other interests in terms of things like, minor surgery, LARC, dermatology, occupational health. So I guess it allows for a flexible work life in terms of doing clinical work, but maybe you have a specialist interest in something else and you have the ability to pursue that. I guess the beauty of general practice is that you have autonomy over your own clinical career. Apart from that, the GP training is very rewarding. You have dedicated weekly time for tutorials. They're embedded in the curriculum, and it's an opportunity for you to develop professionally and to develop colleagues and certainly friends for life from the training schemes as well. If that's all something that appeals to you, it might be worth considering becoming a GP. And the added bonus is that it's a flexible career when you do qualify. If you prefer to work part-time or you would prefer to work full-time, that's an option for you. And the other part of it as well, is that you might enjoy something like teaching or academic general practice. So there's many avenues open to you upon qualification. I do enjoy being a GP. I'm passionate about health promotion with patients. I enjoy the fact that we often manage to treat people before illness actually appears, and I really feel rewarded when we manage to improve a patient's life for the better. Not only the patients, but often the community as well. So it's a hugely rewarding career.